KUAM TV, Facebook Live, the breeze. It's the link. Let's go ahead and get right into it with the hospital administrator, Lillian Posadas, joining us in the KUAM News Zoom room.
Good morning.
Good morning.
Thank you for inviting me to join you.
Always a pleasure to have you on. You got the information, and we'll just get right into it. Right, so let's go ahead and get into our COVID census at GMH.
Okay. We are down to 11. We were at 16 Monday. We've had some discharges. We've also had some admissions. Yesterday, we discharged 3 individuals, and so we are at 11 this morning. 4 of them are in the ICU level of care, not on ventilator, but they are on supplemental oxygen, either through a BiPAP or the high-flow nasal cannula oxygen. And so those individuals 4 of them are in the ICU level of care. The others are telemetry and medical. So that's what we have right now. We continue to have COVID patients. They'll come into the emergency room, and depending on their status and their symptoms, and if they're eligible for the REGEN-COV, which is the Casimirovir, the monoclonal antibody infusion. So they get that, and then they're stabilized and they're in good condition. They go home to either home isolation or to the ISOFAC.
What about kids, so Lillian? Are you seeing kids presenting at the emergency room?
We've had several children under 15. We've had some of them come in. Last week we had a family of 5, the parent and the 4 children who were COVID positive. All of them were COVID positive and all unvaccinated.
The children, were they eligible for vaccination?
No, because they were under, I think 2 or 3 of them were under 12. So they're not eligible for the vaccination.
What were their symptoms? Not yet. What were their symptoms like, if you're able to share?
Fever, the usual symptoms of fever, some of them a sense of loss of taste, some with abdominal discomfort, abdominal distress, some with shortness of breath. Those with shortness of breath were admitted, especially with if their oxygen saturation levels are in the low 90s. The doctors then decide to get them admitted. But the children, those under 12, they were not admitted. They were released home.
Lillian, we we did a story with Margarita Gay, who's, I forget her exact title, but she's like
the supervisor or
high up in the public health nursing thing. But she had said that there were a lot of kids showing up to get tested at the T-Gen testing site, kids who were symptomatic.
Wow. Okay, well, I mean, if they're being tested, that's good, but I don't know what the results are. We get them if they're starting to have, and it depends on the parents if they bring them in to the emergency room, or they probably take them to the outpatient urgent care clinics that are available, and so they may be seen there too.
With so many of the children unvaccinated, when you're seeing them come into the ER, when you're hearing about them going to get tested with the symptoms, does it stress you out? Because
it's worrisome.
Yeah,
it's worrisome, right? Exactly, it's worrisome, especially because what we're seeing also across the nation, the pediatric population, they're getting hospitalized in the intensive care units, and so we don't want that to happen. And that's why it's really important to protect those under 12 who are not yet eligible to be vaccinated. We just need to really protect them. And so those of us who are eligible for the vaccination, please get the vaccination so we can protect these individuals who are not yet eligible.
So we want to protect everyone who can't get the vaccine under 12 years old. In your opinion, given it's almost staggering at this point, the number of students who are testing positive. We had 15 reported yesterday. Yeah, you're saying we need to protect the unvaccinated. Are the schools, do you think that the protections are in place?
From what I'm hearing, is that they are putting in measures to then, protect the kids, such as in some of the teachers are not getting sending the children to go to the cafeteria to eat their lunches. They're keeping them in their rooms, which is really great. However, some schools are not able to do that because students are moving from one room to another. But that's something that perhaps they can be more creative and figure out how to then protect those children, the school age children. So it's doable. It just takes some creativity and some
Yeah.
time. But
We're hearing things.
that really, what's that?
We're hearing things that discussions are in place. I know that some of the options are considering are splitting the student load between schools, or I mean, who knows, whatever. But it's kind of reaching the point where I think a lot of parents feel like something has got to be done, whether it's lightening the load at the school level or offering options, whether it be online
Right.
or. I mean, do you think those kind of things? Because, like you said, I think Guam follows the states. So when the state surges, we get the surges here. So I'm looking
Right.
at the lay of the land, and if we're seeing the pediatric hospitalizations rise in the states, God
Mhm.
forbid that happen here,
Right.
but we should be preparing for that eventuality.
That's right. And yeah, and especially because GMH is the only hospital that serves the maternal child health pediatric population. And so we really need to be prepared for that and anticipate that the possibility that more and more young children under 12 may need hospitalization, particularly if they have already underlying respiratory conditions such as asthma or bronchitis.
Lillian, the 11 that are currently hospitalized, are any of them children?
Not the one individual who was admitted, who was under 15, was released home yesterday. So that's a good sign that, the individual was stabilized and, was able to go home.
What are the age ranges of the people, the patients that are hospitalized? And
Right now, in the 20s to as high as in the 70s, we've got 50s and 60s and 70s.
what's the breakdown in vaccinated and unvaccinated of the 11?
All of them are unvaccinated. And yesterday, when we had the 13, all 13 were unvaccinated. So there's still, those that are remaining, 11 that are remaining this morning are all unvaccinated.
And when you guys administered the monoclonal antibody
The
treatment, right?
Regencov, the
Yeah.
Regencov.
Is that
Mhm.
Regeneron or it's something different?
It's Regencov. I think it is Regeneron, but the name of it actually is uh, Sirinaval.
Have you had any of those that you've administered the Regeneron, Regenco, or whatever it's called, the monoclonal antibody
Regenco?
treatment? Yeah. Have they ever had to come back to the hospital and were rehospitalized or hospitalized?
Not that I know of, because the infusion is given over an hour period intravenously, and then they are kept for an hour for observation. And I haven't heard any reports that they have come back after receiving that. But again, I'll have to verify with the clinicians and with our with Dr. Abrin, who really is our COVID critical care doctor.
And how many patients, non-COVID related patients, have had to been moved over to the SNF to make room?
We started moving them Monday. There were like about 10, I believe, that were identified. So we've moved what we normally was running at SNF 14 patients. We're now up to 24 as of this morning.
And that's including the GRMC non-COVID?
The GRMC patients, I think it's going to be today that we're going to accept them this morning. There are like about, I think, 2 that have been processed in terms of the communication between the doctors and getting all the orders and getting all the information, into our system, or again coordinating all of that. And I think 2 will be ready by today to be transferred over to our facility at SNF.
Again, how many beds are up at SNF?
We are certified. Each wing, there are three wings, A, B, C wings, and each wing has a capacity of 20 beds. But some of those rooms are being utilized for other functions. And so the last count we can accommodate 54 patients into that facility.
Wow, and already you've got almost.
We're at 24.
Yeah,
Yes.
yeah. So what happens when you hit 54? You just, I mean,
What happens when we hit 54? I'm not sure we can even get to 54 because staffing. You got to have the staffing. And we're still challenged with our staffing situation.
so with the staffing you have now over at the
Mhm.
SNF, what's the max amount of patients you can take?
Well, we've decided that we will cap it at 28.
You're going to be 26 today, so you can only take 2 more.
Correct. Mm-hmm.
So what do we do after that then? I mean,
Well, we're trying to get more staffing through the staffing solutions, and we were just off the phone call with FEMA that we can utilize the travel nurses over there. If we need to integrate COVID and non-COVID patients over there, of course, we need to make sure that the ventilation system is separated. And if we get to that point, hopefully that we can get more travel nurses to help us out.
and how many travel nurses do you guys have?
Right now, we have 41. A
And
total of 41 travel nurses from the 2 staffing solution agencies that we contract for these nurses to come to Guam, to GMH.
how many are you guys looking to hopefully bring on board?
Well, our primary focus really is the emergency room, the ICU, and the telemetry, because a lot of these COVID patients need to be on a telemetry cardiac monitoring system. And so we're utilizing most of the nurses in the ICU, ER, and telemetry, most of these travel nurses. That's where we're utilizing them. But if we do need to, we will request for nurses that can help us out over at the SNF. So if you know of any nurse, please tell them to come to GMH or to GRMC.
Well, are we getting to that point? Remember last year, UOG started to fast track the nurses. You know what I mean?
Yeah.
Trying to fast
Right.
track and get as many nurses on board. We started pulling nurses. Well, I mean,
Should
we really
already-
can't
should-
pull nurses.
Should we
from
already be
POE.
doing that though? Or?
Well,
where are we gonna
they
get 'em?
also did the
Yeah.
fast track certified nursing assistant program. So we
Right.
got several nurses aides from that program. We're working with Department of Labor. They started an apprenticeship program to get individuals into and they are already into the program curriculum of becoming nurses aides. They're going to be here in the hospital and doing their clinical practicum. So from that angle or from that discipline in terms of nurses aides, they're helping us get them prepared. It's just the RNs and LPNs is really what we need to have. Last year, UOG, I think they graduated either 24 or 26. We got quite a bit of them into our facility, and most of them have successfully passed the NCLEX, but some of them were able to come on board as graduate nurses. And then they've taken their NCLEX and have passed, and so we're keeping them. Some of them have gone over to GRMC also, which is good, because GRMC also needs some nurses there. So, yeah. We look to UOG and GCC practical nurse program for them to, get those individuals prepared and successfully pass the NCLEX for LPN and RN.
GMH, you guys had a board meeting last night.
That's not.
Yeah,
correct.
can you kind of give us some details? I understand you may have talked about the plan for the rollout of the booster shots.
Right. That they don't want us to call it booster. They just want us to call it the third shot.
Okay.
And that already got approved by Pfizer. So as soon as we get our shipment, which I understand is going to be arriving around next month in September, so we're preparing to then roll that out, the administration of the third shot of the Pfizer. So, and I'm not quite sure if Moderna, I haven't heard anything from Moderna, but Pfizer is what's approved. And so the third shot, we will be rolling it out next month.
Do you know how that's going to how they're going to roll it out? Like, is it going to be the priority groups, like last time?
Well, yeah, and my understanding too are those for those individuals who are immunized, immunocompromised, but hopefully that they also give the healthcare workers that priority because we also want to make sure we protect our healthcare workers so that they are, ready to and are available to provide the care. And probably again, the senior citizens. I'm not quite sure, but Dr. Ogden said that we'll be getting more details in terms of the criteria.
What about your staff, Lillian? 147 cases, positive cases last night. How are things going over there at GMH? I mean, have any of your staff been infected?
Oh yes, there have been some. One or two from a patient that we did not find out the individual had was COVID positive until I think a day later, because the individual came in for another condition, not necessarily for COVID, but when the test came back positive, that one employee was exposed. We have a few who contract COVID outside of work, and then to find out that they're positive and the exposure to their coworkers. And so our own employee health nurse and infection control nurse, they immediately do the contact tracing who were exposed and following through. But we've had, I think since January, from January to last week, I'm trying to remember, I think a total of either 15 or 16 staff tested positive.
Have there been any fatalities in the past 24 hours?
In the last 24 hours,
just
not
in the
within
last
the hospital.
I'm sorry?
Any fatalities at all, Lillian, that you know of in the last 48 to 72 hours?
The last one was that individual, was it a couple of days ago? Today's Thursday. I think either Tuesday was the last individual who was here in the hospital. The individual was in his 80s. And so he passed away.
You're not tracking the fatality of a local woman in her 30s? That
one, we just received information that individual was brought in already expired.
Okay.
It's sad.
Okay.
Can you provide any other information on it, Lillian?
No, I don't, other than what I received. I haven't checked the report. I've been in the Zoom meetings. I haven't checked the report from our supervisors. But I received that information this morning that there was an individual who was brought in by ambulance.
What was the individual a known positive or tested on arrival?
Yeah.
Vaccinated?
Vaccinated?
You know what? I don't have that information, but I can look into it.
Okay, so you're currently tracking what is looking like our 146th COVID-19 fatality?
It looks like it, yes, because that, the COVID positive was a result that I received.
And Lillian, I'm sorry, just one more question regarding the 11 that are at GMH hospitalized. Do they have comorbidities?
Some of them do, diabetes, hypertension, some respiratory condition. I believe a couple of them do not have any underlying health condition.
Okay. And just to the overall count, the census for non-COVID related
It's 129 this morning, I think.
Is that like normal for pre-COVID, Lillian?
Well, remember last year when things were shut down, our non-COVID census was not even reaching 100.
Right.
But then since this year, individuals have been waiting to be seen by the doctors or to get follow-up, and so of course they end up, coming into the hospital. We started our elective surgeries, so that has also increased our census, and we've been running over probably, gosh, there was one time we were up 168, 170 our census, and so yeah, it's up. Basically where we normally are with our non-COVID census. And so that's the difference between last year and this year, is that, both COVID and non-COVID have picked up, have spiked up. So that's our concern, and hopefully that, especially with the pediatric population, that we don't see a continued spike, but we need to be prepared for that.
And is GMH prepared for that?
Well, like I said, we've got the rooms, we've got the beds. It's just now staffing that we need to continue to go after and bring them in.
Thank you, Lillian.
You're welcome. Thank you, and take
you.
care and be safe.
Yeah,
and,
you too.
you.
You guys be safe. God bless GMH.
Yeah, God bless you all too. God bless Guam.
Amen. Right on. It's 9:22. Let's keep it in the KUAV News Zoom room, where we're getting Dr. Ann Pobutsky, Department of Public Health and Social Services. She is the territorial epidemiologist